Hello and welcome everyone. Myself Rizal Rahman and today my topic of discussion is atelectasis. So first of all, we will come to know what is atelectasis. So atelectasis refers to partial or complete collapse of lungs, and when a large portion of lung is collapsed, the partial pressure of oxygen is reduced in blood, and which leads to respiratory disturbances. So what is atelectasis? Atelectasis refers to partial or complete collapse of the lungs, and when a large portion of lung is collapsed, the partial pressure of oxygen is reduced in blood and leading to respiratory disturbances. Now, what are the causes? So, first of all, is deficiency or inactivation of surfactant, and it causes collapse of lungs due to increased surface tension, which leads to some respiratory distress syndrome. Number two is obstruction of a bronchus or a bronchiole, and in this condition, the alveoli attached to the bronchus or bronchiole are collapsed, and presence of air like pneumothorax, fluid, hydrothorax, blood, hemothorax, or pus, that is pyothorax, in the pleural space. Now, what are the effects? Effects of atelectasis are decreased partial pressure of oxygen, leading to dyspnea. Now, pneumothorax. Pneumothorax is the presence of air in the pleural space, and the intrapleural pressure, which is always negative, becomes positive in pneumothorax, and it causes collapse of lungs. So, what are the causes? As the air enters the pleural cavity because of damage of chest wall or lung during accident or bullet injury or stab injury, the types of the pneumothorax are types and effects are pneumothorax is of three types. One is open pneumothorax, one is closed pneumothorax, one is tension pneumothorax. So first one is open pneumothorax. After the injury, an a open communication is developed between the pleural cavity and the exterior, and it is known as open pneumothorax, and air enters the pleural cavity during inspiration and comes out during expiration, and collapse of lungs causes hypoxia, hypercapnia, dyspnea, cyanosis, and asphyxia. Now, number two, that is closed pneumothorax. During a mild injury, air enters into the pleural cavity, and then the hole in the pleura is sealed and closed. It is called closed pneumothorax, and it does not produce hypoxia. Air from the pleural cavity is absorbed slowly. Number three, that is tension pneumothorax. During injuries, sometimes the tissues over the hole in the chest wall or the lungs behave like a fluttering valve, and it permits the entrance of air into pleural cavity and during inspiration, but prevents the exit of the air during expiration. And due to its valvular nature, because of this, the intrapleural pressure increases above atmospheric pressure, and this condition is very fatal since it results in collapse between the whole lung. Now, pneumonia. What is pneumonia? Pneumonia is a common term which is the inflammation of lung tissues followed by the accumulation of blood cells, fibrin, exudates in the alveoli, and affected part of the lungs become consolidated. Now, what are the causes of pneumonia? Inflammation of lung is caused by bacterial or viral infection and inhaling noxious chemical substances. Now, types. Pneumonia is of two types, namely lobar pneumonia and lobular pneumonia. What is lobular and associated with inflammation of bronchi? It is known as bronchopneumonia. Now, the effects. Following are the effects of pneumonia, like fever, compression of chest and chest pain, shallow breathing, cyanosis, sleeplessness like insomnia, and delirium. Now, delirium is the extreme mental condition that is caused by cerebral hypoxia, and the features of delirium are confused mental state, confused way to thought and speech, illusion, misinterpretation of a sensory stimulus, hallucination, feeling of sensations such as touch, pain, taste, smell, etc., without any stimulus. Number four, that is disorientation, loss of ability to recognize place, time, and other persons. and hyperexcitability and loss of memory. Now the next disease is bronchial asthma. What is bronchial asthma? Bronchial asthma is the respiratory disease characterized by difficult breathing with wheezing. Wheezing refers to whistling type of respiration. It is due to the bronchial constriction, and it is caused by spastic contraction of smooth muscle in the bronchioles, which leads to obstruction of air passage, and obstruction is further exaggerated by the edema of mucous membrane and accumulation of mucus in the lumen of bronchioles. Now, what are the causes of bronchial asthma? Inflammation of air passage, leukotrienes released from the eosinophils and mast cells during inflammation cause bronchospasm, and hypersensitivity of afferent glossopharyngeal and vagal ending in larynx and afferent trigeminal endings in nose, and hypersensitivity of these types of nerves endings is produced by some allergic substances like foreign proteins. And pulmonary edema and congestion of lungs caused by left ventricular failure, that is asthma developed due to this condition, is called cardiac asthma. Now, what are the features? Asthma is a paroxysmal, a sudden disorder because the attack commences and ends abruptly. During the attack, the difficulty is felt both during inspiration and expiration, and the bronchioles have inherent tendency to dilate during inspiration and constrict during expiration. So, more difficulty is experienced during expiration, and during the expiration, great effort is exerted by all the expiratory muscle, causing compression of chest. There is severe contraction of muscle, abdominal muscle also. So, the air from lungs pushed through the constricted bronchioles and producing a whistling sound. Now, because of the difficulty during expiration, the lungs are not deflated completely, so that the residual volume and the functional residual capacity are increased. Now, there is the reduction in one is tidal volume, one is vital capacity, one is forced expiratory volume in 1 second FEV1. Number 4, that is alveolar ventilation, and number 5, that is partial pressure of oxygen in the blood, and carbon dioxide accumulates, which results in acidosis, dyspnea, and cyanosis. Now, our topic of discussion is pulmonary edema. So, what is pulmonary edema? Pulmonary edema is the accumulation of serous fluid in the alveoli and the interstitial tissue of lungs. Now, the causes of pulmonary edema, that is increased pulmonary capillary pressure due to left ventricular failure or mitral valve disease. Number 2, that is pneumonia. Number 3 is breathing harmful chemicals like chlorine or sulfur dioxide. Now, what are the effects of pulmonary edema? Effects of pulmonary edema are severe dyspnea, cough with frothy, blood-stained expectoration, cyanosis, and cold extremities. And chronic interstitial edema leads to asthma. Alveolar edema is fatal and causes sudden death due to suffocation. So this is our today's topic. We have some small and important topic today. So what we have discussed today, one is number 1 is atelectasis. What is atelectasis? What are the causes and effects? Then pneumothorax, what it is, what the causes of this disease, these types and effects. Then we have discussed about the pneumonia causes, types, effects. Then we have discussed about the delirium, then bronchial asthma, and then the pulmonary edema. So this is our today's topic. If you have any query or any doubt, you can comment down in the comment section. I will try to resolve your problem, and the question you will ask me, I will try to give those answers. And if you have any doubt, please comment down in the comment section, and please suggest me any topic you want in the next video to be covered. And thank you so much for watching the entire video, and do like, share and subscribe to my channel for supporting me and my channel. And thank you so much for watching and supporting my channel.